Namaste and Siddhi Pranam. Welcome to your today's topic, how to create safe yoga practices for pregnant women. Let's begin with understanding how starting yoga practices prior to conception can actually aid in healthy pregnancy. So as a yoga teacher, it's your aim to equip the mothers with the knowledge and skills that are necessary to help them to have a healthy pregnancy. So you should actually stress upon the importance of starting yoga practice before conception if you get a chance to have them as your students prior to pregnancy as well. So if you are lucky enough to have those students who are preparing to be pregnant and also part of your yoga practice, then that is a great opportunity that you have to actually help them with many practices that can create a very healthy space in their body to invite a new little being into their womb. So first and foremost, what yoga does is reduce stress and anxiety, which is really helpful in conception. And it also trains the woman's mind to learn to let go of physical and emotional stresses. Hence, it really helps this practice of learning to let go of the physical and emotional stress that comes to them day to day. And when they are well equipped and well aware of how this stress impacts their body and how they can use yogic practices to let go of that, so during pregnancy, it becomes a very powerful tool to deal with all the kind of stresses that pregnancy put onto them. So it actually becomes our duty as teachers to really help mothers equipped with all the tools in advance, like deep breathing or meditation or relaxation, such that they are well prepared and geared up to be a mother that they are going to be. And geared up to lead a very healthy pregnancy journey. So all the tools that you're going to offer them in advance, if that is a possibility, then that will really help them go through that phase. Further, if they are also, they have existing mental issues like depression or anxiety or anything, that can also be mitigated with the help of yoga, and they can also deal with any kind of mental health issues during the pregnancy as well. That is what yoga actually helps them. And since there is a stress reduction through the process of yogic practices that we use, what happens is that it also reduces the risk of further complications in the pregnancy like preeclampsia or gestational diabetes if their mind is well prepared and if they start eating healthy way before being pregnant. Another crucial aspect is of yoga preparing the body for the childbirth. So you can teach the mothers how to strengthen their muscles and joints through specific prenatal yoga asanas, which will really help them during the birthing process. So proper alignment and flexibility, which can be improved through prenatal yoga also. So that will also help them to make their delivery smoother and less painful, because it creates more space into their body. They have been training their body to really relax more and be more spacious and relax through any pains and stretches. So that is a process that really is helpful during the birthing journey as well. And in addition to physical preparation, prenatal yoga also promotes good circulation and good blood flow and prevents kind of swelling during the pregnancy time, which is really important to keep the mother healthy and active during the entire phase of pregnancy. And it also further helps in alleviating any kind of back pain that might occur during the pregnancy time. Since if your back is flexible already and you have done enough work on your spine during pregnancy or prior conception specifically, so if that enough work is done prior to conception and making the back more flexible, so that reduces that load that the mother that the bearing a child puts onto the back of the mother. So that also helps her to ease the physical discomfort whenever the pregnancy happens, and she knows and she's equipped with the tools to deal with her back issues as well. Also, the yoga gives her opportunity to connect with the growing baby, and really when in the conception stage, it really helps her to invite the right kind of soul and really connect to that being. And once the child is conceived, she can connect to the growing baby inside the womb. And it can actually really become a powerful experience for her prior to conception itself, so that she's way more prepared and confident to enter into the motherhood. And this is a very beautiful role that prenatal yoga can help her with. So let's move on to the topic of how to manage the safe and smooth pregnancy. So for that, let's really first have confidence on the fact that the power of yoga, what prenatal yoga has in itself, is a true power to gift the mothers with allowing themselves to keep themselves healthy and keep themselves active during this journey, really work on their energies also. So since it is a powerful tool, but it also requires a lot of precautions at the same time. So since we trust in the power of yoga, but really one thing that is there is required modifications at all times. So with proper modifications and certain guidelines that we can provide to the mothers, we can ensure that yoga remains as a very powerful and transformational tool for all the women that is opting for yoga during their pregnancy period. For sure, yoga will really help the mother to strengthen her body and go through the physical demands of childbirth, and also bring sense of peace and harmony at the same time while bearing the child. So it's really important that since we are focusing on the benefits, at the same time we remember that modifications are the key to prenatal yoga. We may not be prepared for all kind of modifications. There are only certain number of modifications that we can actually share and teach during the course with you. But at the end of the day, everything will boil down to the comfort of the mother. You and I cannot really know in advance how a particular body of a mother would feel at a certain point in time. So we really need to adapt very rapidly if we really want to reap the best of the benefits of yoga and also practice it safely. So the first thing that we should emphasize in the modification is that our focus should be to make all traditional yoga postures to be more safer and comfortable for the pregnant mother. So when it comes to modifying the postures, it's important that you remind yourself all the times that the mother's body is going through rapid changes, and hence what is required is to modify the posture every single time. It's important that you remember that if the last week the posture that she was able to do comfortably, it's quite very well possible that she's not able to do it anymore. So adapting to her current position, her changes in the body in the moment is very much required. So avoiding postures like we have discussed it before also in the trimesters, like forward bends. It would require her to bend her knees and keeping an eye on the fact that she's not feeling dizzy or any kind of discomfort while practicing any other asana, and not lying on the back during the second trimester. All those things have already been pointed out in the trimester journey. But just keeping that in mind, that frequent adaptation is what really will meet the unique needs of each mother during this time. And the second and the foremost thing would be to really creating a lot of space in the body, a lot of relaxation in the body while entering into the asanas and while coming from the asanas. So when the mother is allowing herself enough time, what she will have is one thing, and that is listening to her body. It's only when she starts to rush over the practices or asanas or the transitions are not that smooth, that's when she risks herself to injure herself more. So it is your responsibility to ensure that all the transitions are very, very smooth and they are coordinated, well coordinated with the breath also. So if all asanas are well coordinated with the breath, done with smooth transitioning, done with a lot of mindfulness, then we reduce significant amount of chances of any kind of injury to the mother or the baby. So the only key is you allow the time and space, you be the space provider and the facilitator for the mother to be able to listen to her own body. You don't have to act as a guide there, but really a facilitator for the mother to know how to move. She knows herself, she knows her body more than anyone, but she needs that right space to listen to her body. So just focusing there that what she requires in the moment, and that only she can know if given the right space. And that should actually be told to all mothers prior to starting the yoga practice itself, that we need to emphasize enough to the mothers that they should stop immediately if there is any pain or discomfort being caused to them during any of the practices. And the goal is not to practice all asanas taught in the class as it is, but the goal is to relax enough, to let go enough, to really surrender enough to the flow of life, to the flow of nature, to the flow of breath. That should be the goal, and not to really follow the teacher and practice asanas perfectly. That's not the goal. The goal is to really let go, surrender, relax, stay in your comfort zone. So that's the goal for the mothers, which may be quite different from traditional yoga practices where we actually push ourselves beyond our comfort zone. But here, we always need to stay in our comfort zone because we cannot risk to put the baby at risk at any point in time. You should also guide mothers to stay hydrated during the yoga practice and also be really, really mindful of their breathing. If they are breathing heavily, then they need to stop. If they are pushing themselves to the point of exhaustion, they should stop. Whenever they are getting too exhausted, that's not what we want. So we want to do it slow and steady. Few asanas, relax. Few asanas, relax. So that should be the goal. And if mother knows that I don't have to get myself exhausted at any point in time, then she would be your partner in practicing quite mindfully. And really together you will create that beautiful space for the body of the mother as well as a beautiful space for the baby as well to stay safe and comfortable in the womb and grow very productively and healthy. So next would be how to really assess any kind of posture, any asanas, how to assess it from an eye of a prenatal yoga, whether any asana is actually safe for the mother or not. So the assessment method consists of 6 key elements. First, expanding space. Second, the pose effect. Third, the joint lubrication. Fourth, contraction of the abdomen. Fifth, steadiness. And sixth is the discrete analysis. So let's understand each step in detail. So the first element of asana assessment focuses on making enough room in the body. As the body grows, the woman's body undergoes significant changes, and it's important to ensure that poses creates space and comfort both for the mother and the baby. This is especially important for the poses where the body is bent forward, as this can create a lot of pressure on uterus, which can be uncomfortable and potentially harmful to both mother and the baby. So to create space and comfort should be our first focus, and hence whenever required we need to lengthen the torso or any other modification is required. That is what our focus should be, whether the pose or the posture is expansive or not. And whenever required, if there is too much contraction or too much pressure on any area, whether that be the uterus or the abdomen muscles or the back, if there is any kind of pressure or discomfort that is felt anywhere, then that pose either should be avoided or modified as per the need. So that is the first key, whether the posture creates expansive space or not. Second element is the pose's effect on the pregnant belly. So what we need to focus here is on the effect of the pose on the abdomen muscles. So during the pregnancy, the abdomen muscles naturally separate to accommodate the growing uterus. This separation is also known as discestus recti, and it can really cause a lot of discomfort and weakness in the abdomen area for the mother. So to minimize this separation and support the abdomen muscles, we should avoid any posture that accentuate this separation any more than necessary. So that should be our focus. So instead, we should really focus on poses that support the abdomen muscles and help maintain their strength and stability. And this can really be done by incorporating poses that target the transverse abdomen muscles, such as maybe pelvic tilts and slight abdomen twist. Wherever it's too much deep twist, we should avoid that. Instead, really introduce only very slight abdomen twist to ease the discomfort, not to harm it further in any manner. And we should also avoid poses that put too much pressure on the core area or the abdomen area, such as plank or side planks or main planks. So anything that puts too much pressure on the core, any asanas that we would normally do to strengthen our core, that's not what we want to do in prenatal yoga. So very simple key to understand that anywhere you're trying to build your abs, that's not what is required in the pregnancy time. So that all postures or asanas or exercises should be avoided during this phase. Instead, we should actually use more of relaxation postures like maybe cat-cow or child pose, etc. Now, the next element would be focusing on joint lubrication. Now, what is joint lubrication? So, during the pregnancy, the body produces a hormone called relaxin, and that helps to lubricate all the joints and the connective tissues. This hormone helps the mother to prepare the body for childbirth and making the joints more flexible and relaxed. However, it also means that the joints are more susceptible to instability, And it's important to avoid poses that put too much stress on the joints or pull the joints in any manner. So to minimize the stress on the joints, we should avoid poses that put excessive pressure on the joints, maybe deep squat, or instead we can opt for more supportive lunges or warrior poses. Even if squats needs to be done, we can use a wall or maybe chair, any kind of support that can really help. So additionally, what we need to be mindful of is the alignment of the joint, and encourage the mothers to avoid poses that are placing excessive weight on the hands or feet, such as maybe we are anyway not going to do handstands or headstands, but we should, even if we are, let's say we are doing downward facing dog, that also puts a lot of pressure on the hands and the wrist also. And we have mentioned in the contraindications, there's a condition called carpal tunnel syndrome, which puts a lot of pain into the joints also. So if that is the condition, then of course we need to modify a lot. But even if that's not the condition, we can still use, let's say, a bit of support or maybe slight cushion under the hands to give more support at any point in time. So just taking care of not to put excessive pressure. Another important fact that you need to know, if the woman who are practicing yoga with you is overweight, in that case, the weight on the joints are already too much. So since her body weight is too much, so there is excessive pressure on the joints already. In that case, the transitions needs to be way more smoother, and also we need to be way more careful on the joints at the same time. So you need to give extra instruction to women who are overweight to not to put excessive pressure at any point in time on any kind of joints while practicing all the asanas. The next element would be contraction of the abdomen. So just see that the belly is not compressed at any point in time. If the asana or the posture puts any kind of pressure on the belly, that's not what we want to do. What we need to check with the posture is the posture accommodating the growing baby or not? If not, we need to avoid those kind of poses that can put any kind of excessive pressure on the belly. This is why poses where the woman is lying on her belly or compressing it should be avoided completely. We have discussed this before. We do not do any kind of belly lying postures during prenatal yoga, as this can be really uncomfortable for the mother, even if she's in her first trimester. So additionally, twists that involve compressing the belly should also be avoided. However, not all belly touching is considered compression. For example, a forward fold with legs apart where the belly touches the thighs is not compressive as long as it's comfortable. So we really need to guide the mothers all over again that no matter what is being guided in a yoga class, at the end of the day, they know the best whether they feel sense of safety for their baby or not. So no matter with whatever safety guidelines you are guiding the asana, but at the end of the day, we have to rely on the comfort of the mother. So if she feels that spreading her legs a little wider creates more space for the belly and she's comfortable staying in that posture for even for a little while or bending forward, whatever the asana requires, and that is expansive for her and she's comfortable in the posture, then that indicates that we are on the right track with the yoga asana. So if we keep the comfort of the mother and her listening to her own body as our first and foremost priority, we should sail smoothly through every asana during the practice. Now, the fifth element of the assessment method would be steadiness. So we really need to check the stability of pelvis, specifically the sacrum and the pubic symphysis. During pregnancy, as discussed before, the hormone relaxin increases, which causes the pelvic to become more mobile also. So this increased mobility makes the pelvis more susceptible to instability issues, which can cause discomfort and pain. So to help prevent these issues, it's important to assess the stability of the pelvis when we are suggesting any yoga postures. So what we should look at is basically the posture is providing stability to the pelvis rather than exacerbating any kind of instability issues or creating any sense of discomfort in the pelvic region. So poses that can help strengthen the muscles of the pelvis and the hips, such as like glutes and abductors, can especially be helpful for maintaining the stabilities. And additionally, the poses that encourage pelvic alignment, such as squats, can also be beneficial, but that comes with a caveat of various conditions in the pregnancy in which we are not like allowed, or we should avoid squats at all times. So every woman's condition is different, her medical conditions are also different, so we have discussed this different medical conditions where squatting should not be done. Otherwise, in most healthy normal pregnancy cases, slight squatting should be beneficial in alignment of the pelvic region, and also prepares the body to open the pelvic region slightly to make space for baby to pass through easily from the vaginal canal. The next would be really coming to the discrete analysis of how can we just quickly see if the posture is safe. So the final element of this method will take into account the individual woman's pre-pregnancy ability, also the fitness level, her stability, flexibility, and any past or present injuries. So it's important to remember that every woman is different, and what may be safe and comfortable for one woman may not be the same for another. So this is why it's crucial to personalize the yoga practice to meet the unique needs of each mother. And so we have to really assess the abilities as well as the limitations of the mother, and then really adjust the postures accordingly. I'll give you an example. For example, a woman has a history of a lower back pain, and then in that case you may need to modify certain postures to provide additional support to help elevate any kind of discomfort in the lower back. Additionally, if a woman has, let's say, limited flexibility, then you may need to modify postures to make them more accessible. And it's also important to remember that a mother's ability and limitations may change throughout her pregnancy. So it's crucial to reassess her needs regularly. And so we really need to encourage the mothers to listen to their bodies at the end of the day and adjust the practice accordingly. Also, if they are able to update you on their conditions, on their results of their medical tests, or any medical conditions showing up later in the pregnancy, if you are updated with all that, that will be really helpful information to know where they are aching basically, or do they have lower back discomfort, or joints are paining, or legs or feet are swelled, all those medical conditions that occurs during the pregnancy phase. If you're aware of what is changing in the mother's body and what has changed over even the period of week, you would be really able to modify the postures to help the mother in the moment. And what we need to stay proactive with is knowing that we really need to listen to our own intuition also while doing this assessment method. So sometimes even mother don't know what's right for her, and we really need to align ourselves with her needs, and there only just a kind and compassionate listening would really help. And just being gentle to her at all times, just being providing that comforting space can also sail you through and sail the mother through all the kind of practices and the whole pregnancy overall. So I believe this assessment methods will be really helpful in order for you to provide the best of the practices that yoga has to offer for a pregnant woman. Now, moving on to the frequently asked questions. First is, can I do inversions while pregnant? This is often asked, especially by the women who have been previous yoga practitioners. So in short, inversions in yoga refer to any posture where the head is below the heart. So during pregnancy, women are advised to avoid inversions as it can put pressure on the uterus and restrict the blood flow to the baby. However, if the women who have been regularly including inversions in their practice before the pregnancy, they may wish to continue doing the inversions while being pregnant. In that case, it is important that it is done with utter precaution and also with best possible support of, let's say, cushions or yoga blocks or yoga mat or whatever is required. So if it is even being done, it should be done in the presence of someone, either someone who is taking care of the mother or the yoga instructor himself or herself. So if even they are practicing slight inversions, if they are doing it in your presence, you can probably help them not to push beyond their limits and avoid any injuries. So women with high blood pressure also can develop excessive amniotic fluid or heartburn during pregnancy, and in that case they should completely avoid inversions during the pregnancy. So even though if they have been practitioners before, but if they have high blood pressure for any reason, then the amniotic fluid is excessive, and then in that case inversions should be avoided completely. And even if they decide in any case scenario, not the women with high blood pressure, but normal pregnancy, no heart conditions, medical conditions, tough medical conditions. If a woman is in healthy pregnancy and is willing to do slight inversions, it's only recommended to do it not more than 30 seconds. So in general, just staying mindful of the changes of the body and readapting the practice through the changes will be really, really beneficial. And at any point in time, not putting any kind of pressure or strain on the belly or the baby. That always remains as the key. So next is, can I do back bend while being pregnant? So back bends in yoga refers to postures where the spine is arched backward. So during pregnancy, women are advised to avoid intense back bend as the weight is already added on the spine that can put additional pressure. So when we do back bends and the belly is already carrying a heavy weight, that can put additional pressure on the lower back. However, if the women who have been regularly doing back bends and wants to include back bends in their practice, then it should be done with utter precautions. Also, in most cases, they should support their lower back. Let's say if they're standing and doing slight back bend, they should support their lower back with their hands, you know. And if they haven't been doing back bends at all in prior to pregnancy, we recommend that they should not start doing it in the pregnancy, because their body is not prepared, or the spine is not prepared for that kind of pressure. So the increased weight on the spine during pregnancy, especially in the late trimesters, like second or third trimesters, can really put a lot of pressure on the lower back. So even a slight jerk can cause many injuries. So that is the reason we want to avoid back bends in any situations. So what we can do is really focus on gentle and moderate postures that support the spine and help relieve any discomfort from the spine or the upper back that they are experiencing. Our next question is, why can't I lie on my back while being pregnant? We have answered this before, but I would really like you to go through it once again, that after at least around 4 to 5 months of pregnancy, women are specifically guided not to lie down on their backs. In fact, they should not be even sleeping on their backs, because the uterus can really compress the vena cava, which is a major blood vessel responsible for bringing blood to the heart and from the rest of the body to the baby. So when the woman lies down on her back, the weight of the uterus can restrict the blood flow to the heart and to the baby. So the results of lying down on the back for a prolonged period can result into, dizziness and lightheadedness, as well as decreased blood flow to the baby. And this can potentially lead to decreased oxygen and nutrient delivery to the baby. So, which is why it's really important to avoid this posture or position, especially after 4 and 5 months. And you should remember that it is not about the month, it is about the weight of the belly and the baby. So if the woman is only pregnant, let's say 3 months or 2 months, but she has, let's say, twins or 3 babies in the womb or 4 babies, then of course the weight will increase much faster than we can anticipate. So we need to adjust and accommodate accordingly. And then in that case, then women needs to stop even sleeping on their back much prior to 4th month or 5th month. So all they should be doing is sleeping on their side, maybe with a pillow in between their thighs, for added support. This will really help them relieve any pressure on the back and reduce any discomfort they might be experiencing while sleeping. These days there are a lot of pregnancy pillows that does the same and really help sleep in the sideline posture for the mothers. They can obviously use that, and there are many other tools that are helpful to get a better sleep while in pregnancy. Now next would be, can I use yoga to help turn a breech baby? So breech baby is a position where the head of the baby is upward while during 36th or 37th week, which is a time which is a time nearing to the delivery. And this is when, if the baby's head is upwards and not towards the vaginal opening, is a little problem. Because in breech baby cases, if the baby doesn't turn the head downwards in time, the only solution is to do a cesarean delivery. And normal delivery is usually very risky and can cause suffocation to the baby. So in these cases, nowadays, mostly in 100% cases, if the baby is breech, then the mother has to go through a C-section or a cesarean. So coming on to if yoga can help with turning the baby around. So yes, some postures and some asanas can be used effectively to help the baby turn after 36 weeks of pregnancy. And one of the most effective position is supported bridge, where the mother places a large stack of pillows under her hips to create an angle of 45 degrees from her hips to the head. So, and the mother can actually stay in this position for, let's say, 10 to 15 minutes, 2 to 3 times a day. And this might encourage the baby to move into head down position, increasing the blood flow and oxygen to the baby and for the delivery also. So, but a caveat is there. If the mother is in a normal pregnancy and the baby's head is downwards at the time of 36 week or 37 weeks, that's not when you are not supposed to do bridge pose at all. So because we don't want to encourage baby to move any further, we want the baby to settle more. So that is the time to maybe do more squatting rather than doing even slight inversions such as bridge poses. So this is only recommended when you have a breech baby position. So yes, I hope this was helpful, and see you in the next chapter. Thank you. Namaste.